Jai Sri Ram friends, welcome to Bharat Marg. Welcome Vinay Ji to Bharat Marg. What a it's we are going to talk about a very important topic today. It's total collapse of Canadians' healthcare system, and people are dying. Okay, doctors sweeping floors. Okay, if you are going to your ER and not knowing your doctor, where the doctor is, maybe see what is happening inside. Okay, but we will talk in detail with political analyst Vinay Ji to see what is really rot, what is the rot here. Let's discuss about it. But friends, if you are here for the first time, we'll highly recommend you to subscribe the channel Bharat Mark. And also friends, make sure to press the notification bell so that you, whenever we go live, you are getting informed, so that you can come along with the title, so that you can come and become part of the conversation. And also friends, please like the video, comment on the video, share the video as much as you can to spread the message. And Vinay ji, total collapse of the healthcare system, people are dying.
Yeah, it's very unfortunate and tragic as well that this happened. But what surprises me is that this happened in Nova Scotia. I mean, if it was in Ontario, where I see this happening on a routine basis. I mean, not that I go to the hospital, I don't work in a hospital, but occasionally I've had a reason to go to the hospital or whatever for a checkup or something. Or, I one of my friends is actually a heart patient, and I have to, I have volunteered to drive him once in a while to the hospital, and I
Mhm.
see the chaos there. In Ontario, it's a normal thing, and I go to the the Brampton Civic Hospital, or the William Osler, or the one in Mississauga, and even in Toronto, right? I've had to take him to the Margaret Princess Margaret Hospital. So the thing is, it is chaotic. I mean, if you go to especially the ER side, I normally don't go there because we have appointments, but ER side is chaotic. And I've had an instance myself. I had an experience a few years ago. Where I had to end up in ER, and I was in triage for almost about 6 hours. So we got in around 11 p.m. And by the time a doctor saw me, it was close to 6 a.m. So, and I was in pain, absolute pain, and you can't do anything. And if you ask for any painkillers and whatever, right, the nurses are not allowed to give any painkillers because they're not doctors. And until the doctors are seeing you, can see you, they nobody can give you any medication. So you just have to endure the pain. So same thing exactly happened in Nova Scotia. So let's get to the Nova Scotia incident. So a gentleman by name Gunter Holtoff of Tidnish, Nova Scotia, took his wife Allison on to the Cumberland Regional Healthcare Center on the New Year's Eve, which is December 31st. She was in pain. Apparently, she was suffering from some stomach pain, and she began to feel sick the morning of the 31st, and she thought it was a upset stomach. And when it worsened through the day, he kind of took it to the emergency around 11 a.m. And when they arrived in the hospital, the triage actually took her in and then saw her, and then basically she was asked to wait outside on the stretcher. And 11 a.m. to 6 p.m. before she was actually waiting for a doctor to see her. And at 6 p.m. a doctor finally came in to see her, but she was in so much pain that the condition had worsened. And And at one point, she was asked to take a urine sample, and Gunter actually had to walk her to the washroom, but he was unable to carry her, and he asked for help, and they did not give her any help, and she fell on the floor, and which actually made it even worse. So then she was she was on the wheelchair, and I thought it was actually she was no longer able to sit on the wheelchair. I thought it was a stretcher, but actually it's a wheelchair. And finally, she actually went on the floor, cuddled up like in baby position, and she was just holding her stomach and just sitting there for somebody to take a look.
Hmm.
And no medical treatment was given, no medical anything was available. And so this went on till finally a doctor came in to see her. And finally, when the doctor came in and he looked at her and whatever, right, it was already too late. So the doctor tried to resuscitate Allison about three times, and but no luck, because she had already lost her consciousness, and unfortunately it was too late. So
But
7 hours
see,
later,
see
and yeah,
the
severe. She had too long a time without sufficient blood flow to the brain and vital organs, and nothing could be done, and she just passed away.
and the one thing what people will be surprised to know was she was not this bad when she walked into the hospital. She walked into the hospital.
Correct.
She was not rolled into the hospital.
No, no, she walked into the hospital, and she it was not, But the thing is, see, the thing is with emergency, right, with ER, they have an unwritten policy. Okay. And again, I'm going to say something about the Canadian healthcare system. I hope nobody is going to knock on my door. Something bad, something terrible. There is an unwritten policy about the ER, where they look at the scale, basically what is the pain level or what is the severity level of this patient who is walking in. Is he on the scale number 9 or 10? 9 or 10 is the, like, if it's a stroke, a heart attack, or something related to something that is critical, right? Or brain damage, or something which is going to probably end up the patient may end up in either coma or lose his life. So that is kind of called severity 9 and 10. So those will be attended first, and then based on the severity, like, okay, your stomach pain will be in the severity of 3 to 4.
Yeah,
And
exactly.
and leg pain or ankle pain or anything else is probably even lower, and a bruise or something, a cut or something, is probably even lower. So that's the way it is kind of
But
categorized.
logically that sounds okay.
It sounds okay logically, but the thing is, we don't know what can trigger what. Only the doctors can tell. So, if the doctor says, okay, based on the triage is done by a nurse. Okay. And nurse is not as qualified as a doctor, obviously, because nurse has her own responsibilities. I'm not going to undermine the nurse's responsibilities. They have a huge responsibility of taking care of the patient. And at the same time, doctor has a different kind of responsibility. He's the one who is allowed to diagnose a problem. He's the one who is allowed to um, uh, prescribe a medication or whatever, right? So given that, the issue with what happened here was, the nurse was not qualified to diagnose the issue. So she put the patient on a 3 to 4 severity level, right? And based on that, they basically say, okay, this patient doesn't need attention, doctor.
Absolutely, absolutely. I just want to clarify something here when you're
Mhm.
talking about it, because on seeing she was like that because she walked by herself when she came into the ER
Mhm.
in the emergency room in Canada. She walked by herself with her
Yeah,
husband,
correct,
and she got worst being in ER.
correct,
But they were always doing the monitoring when she walked in, how she was.
correct. So now let's get to the root cause of the problem. What is the problem? Why is there the severity scale? Why is every patient not people talk in Canada about equity, equality, equanimity, equitability, and all that, right? So why are the patients not treated the same way? Why is every patient not treated the same way? The reason is there is a systemic problem in the Canadian healthcare system. And the systemic problem in the healthcare system is that we are bringing in a lot of immigrants into the country. We are bringing in refugees, immigrants, and the surprising fact is Canada's population growth is in single digits. Okay, so which means the only way to kind of bump up the population growth is by bringing in refugees, by bringing in immigrants. However, the problem with the Canadian system is we don't have infrastructure that is going in parallel with the population growth. If the population growth is 10%, the infrastructure growth should also be 10%. However, the infrastructure growth is about around 1 to 2%, but the population growth is around 10% or 20 or 15% based on immigration and refugees coming in. Okay. The indigenous population growth is like less than 10%, what I said. But the infrastructure growth is not proportional to the population growth. And this
Ab-
is a major problem. This is a systemic problem which the government is not addressing. They are kind
Absolutely.
of they've dropped the ball, especially on the healthcare system, and they're unable to cope with the number of people coming in, the number of people going to the hospital, and whatnot.
Absolutely, I agree with you. The government is just on time saying that we are bringing 500,000 people a year. We will make 1 million people a year. What the heck is that? You don't have, the whole of Brampton, which has almost 1 million people, you will say, Brampton.
Yeah, around.
You know, Definitely more than 500,000, right?
Yeah. It's around in the 500,000 or 600 or 700,000
You know,
range somewhere in
and
that.
I was surprised to know they have 1,000 ER beds in total.
For the entire population,
The entire population of Brampton.
right? And there's only one hospital. There's only one
Yeah,
hospital in Brampton.
and in Nova Scotia, people are lucky. I'm saying feeling further, and they had a wait of 7 hours, right?
Yeah,
In Nova Scotia, it's not to Brampton,
yeah,
because Brampton 7 hours. If you are getting inside, you are lucky.
that's right. Yeah,
Yeah, you know what
yeah.
I mean. Be it's
No, no, I'm
whole
I'm I'm
night you will be
surprised. That's
sitting.
why I said when I started off, I said I'm surprised this happened in Nova Scotia because Nova Scotia is a much smaller population. The ratio, the population to the number of beds in hospital is a lot, is pretty good. Okay. However, the ratio of population to the hospital beds in Brampton or the Toronto or Ontario, for example, is way low because and it definitely needs improvement, and that's why I'm
Absolutely.
surprised that this happened. So what the lessons learned, what we have to learn from this is, if this can happen in a smaller province which has a higher ratio of beds to the population, if this can
Mhm.
happen in Nova Scotia,
Mhm.
guys, we need to wake up in Ontario. Ontario,
Mhm.
you have to wake up. The government has to do something about it, and it's a combination of the federal government and the provincial government who have to collectively come together and say, yes, we've got to do something about it. I mean, election time, you've seen every person who comes into this election campaign, like, mayors and whatever, right? Oh, yeah, we're
Mhm.
going to bring in a new hospital here. We're going to bring in a new hospital in Brampton. But Has that happened in the last 10 years? No. So that's
Absolutely.
the unbelievable part. I mean, like, even William Osler is a new hospital. It's been
Mhm.
around only for in the last, like, I think it came up in the last 15, 20 years maybe.
No, no, no,
So
less than that. Yeah.
that's
Yeah,
what I'm
maybe
just
you are right.
guessing.
Yeah, 15 years probably. Yeah,
Maybe
you are
15
right.
years, right?
Yeah.
So where were the Bramptonians going before that? They were going to Toronto. So you can imagine, like, if the infrastructure growth is so kind of laxed and slow, then how are we going to support the population growth? I've got nothing against population growth, but government also has to create infrastructure, provide jobs, create industries. Whatever has to be done, the proportionality has to be at the same level as the
See,
population growth.
Vinay ji, see here, this is something interesting. Allison Health of death occurred after two managers at the Dartmouth General Hospital last month warned in an email to staff that overcrowding and lack of resources in many emergency rooms across the province were leading to situations where patients are dying in the waiting room. Okay, you see that?
Correct.
Okay, this is a confidential email, by the way, which was getting dug out. Okay,
Mhm.
Nova Scotia Health later clarified that a manager meant that some patients are dying because of the health complications due to long waits rather than, see, it's not a one of a kind. You know, it's a epidemic. You see here
Mhm.
what they are saying. Patients are dying in the waiting
Right.
rooms, right? This is one thing. And you see, and when they are now, they were cornered. Okay, you said patients are waiting in the waiting room, dying in the waiting room. The health department said, no, 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 we said they are getting while waiting in the waiting room, they are getting health complications and dying,
I
not
want
because.
to I want to elaborate on that last
Uh-huh.
point. Okay. The last point, very, very nicely said, because they have to protect themselves, because they don't want to
Mhm.
make this a big deal. Everybody's job is online because these guys work for the healthcare system, so they don't want to lose their jobs. So they want to say, oh, no, 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 the manager, what he said is, they're not dying in the waiting rooms, but they're dying due to delay in actually seeing these patients. What does
Right.
that mean? Okay, let's give an example. A patient walks in,
Mhm.
waits for 7 hours to be seen by a doctor.
Mhm.
Okay, there are two possibilities there. The doctor
Mhm.
comes in 7 hours later, but the patient is already dead in the waiting
Right.
room because the patient is unable to endure the pain, or it's gotten more complicated or whatever. So the
Right.
patient is already dead when the doctor walks in. That's
Right.
one possibility. Okay, which is probably rare, but it happened with in Allison's case.
Mhm.
In the other option is what the authorities are saying themselves. Due to the delay, the doctor, okay, says, all right, now bring this patient over to ward number 13 or room number 43 or whatever, right? So they roll the patient into room number 43, and now the doctor starts checking it out and checking him out or checking her out. And then guess what happens? The complication, again, the complication is kind of quadrupled, and now the doctor is trying to do whatever he can do to save the patient,
Right.
but the patient now has a only a certain span of life. Okay,
Right.
because the doctor is there, they're trying to do everything possible and whatever, right? But again, you have to keep in mind, as per the authorities, this is not coming from me, this is coming from the authorities, the doctor has seen this patient a few hours too late. Had the
Absolutely.
doctor come in to see the patient earlier, maybe the patient would have survived. But the doctor came in very late to see the patient, and now he's doing whatever. They're giving him oxygen, they're giving the patient blood, they're giving whatever, and any lots of checkups and this and that and medication, so many things going on, right? But guess what? It's too late. So the
and I,
patient
I
is going to die eventually.
absolutely, absolutely. I want to show you some other piece of what is happening really here for the people to understand, and you can touch upon it as we go. You can see here. I'm just getting it on the full screen. Okay, Canada's healthcare system is collapsing around us. One CMA president. Okay, she goes on to say how the whole system is pressure across the system. Okay, and this is one thing. And now, see, this is what I was talking about. Where is your doctor cleaning the rooms? There is no one else there to do it. Okay, this is from Toronto Star. Some of you
Mhm.
must be thinking I'm just hyping it off, you know but that's not the case. When the patient is rolled in, there is nobody to clean the previous patient who left that room. So the doctor is cleaning the room and spending the time there because there is no cleaning force.
Oh
Okay,
my God.
shortage of doctor is one, and shortage of the cleaning staff is sucking in the time, and most of these doctors are overloaded by everything. Okay, see here. Where is your ER doctor? Cleaning the room. There is no one else to do it. Exhausted with this, it goes on to say how they are exhausted. See, Vinayji, what do you say?
So that is the unfortunate part, because a lot of stuff is going on with the healthcare system. There is a systemic issue. There is nurse shortage. There is cleaning staff shortage. I'm surprised cleaning staff shortage, because during COVID time, nobody wanted to work in hospitals. Okay, and even there was no volunteers. There were no cleaning staff. A lot of them were out of fear for their own life, and for their
Mhm.
own health. They didn't want to end up in hospitals working, where there is so much. You're so vulnerable to all these diseases, especially COVID. So people stopped working in hospitals, and then many of them left the system. And now the government, or the healthcare systems in across different provinces, have not brought these people back in. And nurses are again a huge commodity, actually, because it's very difficult to find nurses. I mean, forget doctors. Even nurses are very difficult to find, because nurses are also immigrating. Nurses are also going into other professions, because they're sick and tired of the profession. and uh,
Long shift, long shift.
and then there, yeah, because the amount of stress that they have to endure is a lot, because they start on a in the hospital, let's say at 7 a.m., and they have to do like 2 to 3 days straight. Where are they going
Agreed.
to get their sleep? Where are they going to get their apparently they're supposed to be on call. Okay, when somebody is on call, it means that you work 8 hours, and then you take 8 hours of rest. But during those 8 hours of rest, somebody could call you, like you could get paged or whatever, and then you just have to jump in. But it's occasionally that happens. And then you go back another 8 hours, work straight at 8 hours. So you're on call for 3 days. But guess what's happening? Because of the influx of patients that's coming into the hospitals, and because of the systemic issue, the doctors and the nurses are working straight 72 hours. One of my own friends is a doctor, and he
Mhm.
he he had completed a 72-hour shift. Okay, 72-hour shift, and he was driving back from London to Kitchener, and guess what happened to him? He fell asleep on the wheel, and he met with an accident. And this was just a few months ago. So
Yep.
these are the health hazards that we have to face.
And one more thing, let me say you that. Okay, Vinayji, you will able to address this. Okay, a doctor doing the same job in US makes much more money than a doctor working his nose off, grinding his nose in Canada.
Absolutely. Because in the United States, there is accountability. Here there's no accountability. And the
And
way and the way doctors work there, they also do on call, they also do straight shifts, but the thing is, they are accountable to the system, okay, and they're accountable to themselves. So basically, if somebody starts a shift at 7 a.m., he does his 8 hours or 10 hours, but he gets a straight rest, okay, and he will be on call. Maybe he'll be called once or twice during his rest time, but and then he'll go back. It's not like here, you're supposed to get your 8 hours of rest during your on call time, but you are still working during those 8 hours. I mean, the first couple of shifts, right, your full your adrenaline is on full swing, and you can actually work. But the problem is, after you hit that peak, right, then your body starts dropping because it can't cope with the thing. And the good thing about the US system, there is also insurance. So although the doctors make a lot of money, they are also liable. They're also highly liable for anything that they do wrong, because after 16 or 20 hours of your working, your mind starts kind of playing up. So at that point, if you are unable to diagnose an issue, or wrongly diagnose or misdiagnose something, and it has happened here, okay, I mean, it has happened to me. I have an experience. I went to Six Children's Hospital, and at the ER, one of the doctors, my own kid had actually put a crayon in his ears, right? And the doctor who was at the ER was on. I think she had already done about 3 8-hour shifts, so she was like on her peak, and she still had another 3 more shifts to go. And guess what she did? When she used tweezers to pull the crayon out, and in the process, she actually pushed the crayon even deeper inside. And then what happened? She said, "Oh, I'm sorry, I can't help you. So I'm going to put you onto a specialist." And then, fortunately, the specialist was available the same night, and we went to the specialist to see him. Again, it was about a few hours wait because this was not emergency, not dire emergency. So after about 6 hours of wait, the specialist came and he said, "Okay, you know what? Based on the X-rays that I've seen, the crayon got pushed in." And my wife was like, "No, no, it was, I could see it from outside. Like, what are you talking about?" He said, "No, when you came into the ER, I think somebody pushed it inside even further. So now the only option is you have to bring your son back for a surgery." So we had to come back for a surgery a week later to get this done. And that was misdiagnosis, and that was mistreatment of the kid. But guess what we had to do? We had no recourse here. But had that happened in the United States, that doctor could have been sued for a few $1 million.
Yeah, absolutely. I remember in my family, the doctor wrote zero point 0.1 ml of the medicine, zero point 0.1 ml to inject. But nurse in sleep, she put 1 ml,
Oh my God.
and my wife went out almost to coma in that.
Oh
Okay,
my God.
unbelievable.
Yeah.
But thing is, see, if you see from their perspective, unless and you are in Canada, you are a very very top notch doctor, you are just a middle class family.
Yeah.
You are not making money like what you are doing in even in US.
No,
Okay.
no, absolutely. Because in the US, you make a lot more money. Yes, you pay a lot in health insurance because any of this misdiagnosis, mistreatment, or anything, people sue you and you have to be covered. Every doctor in the United States is covered through insurance. But at the
Yeah,
same time, the reason the insurance is extremely high, some of the doctors, they pay a premium of $1 million a year. Just
absolutely.
insurance premium is $1 million a year. So which means their income should be in the range of at least about $3 to $4 million a year.
Absolutely. I have a friend of mine who was a neonatologist and who retired from the profession. She didn't want to do it. But the last kid which she delivered, and that she has to carry the malpractice insurance for till 18 years till that last kid turns 18.
Right.
You know, that's unbelievable for me. But anyway, yeah, but Canadian system, I think it is stupid of the government to bring in so many people without fixing the basic necessity, and the hospitals are flooded. You cannot even, who can you complain? It's a
Exactly.
it's a it's a it's a politicians who are the real culprit, in my opinion, for their
Absolutely.
vote bank politics. They are bringing in
Absolutely.
so many people and converting Canada into a real third world ditch hole. What do
Yeah,
you say?
it's not going to be too long if the government and the systemic issues are not addressed. It won't be too long before Canada goes back into becoming a third world country.
Absolutely. So much of robbery, so much of this thing, and I'm hearing now this. I expected 1 year before this will happen. So many people are defaulting on their mortgages now.
Yep.
But anyway, a lot of things, folks. What do you think of this? People dying in the. People think. See, I believe Canadian government is making money by selling the applications to the immigrants.
Hmm.
Okay, they sell so many applications,
Yeah.
and they, if they are bringing 500,000 people, at least 500,000 would have got rejected, in my opinion. So they got a good revenue through it. That's all they do, and they sell the dream for the people, saying that, oh, you come to Canada, it is like this, it is like that. But when you come here, the hospital system is collapsing, the healthcare system is, it's not Vinay ji, nobody will knock at your door. I am saying you didn't say this, because see here, it is said by the Canadian healthcare system is collapsing, collapsing around us, one CMA president.
Yeah.
So if anybody knocks at your door, you can blame her for it.
I'll
you know
tell her that
she
she's my friend and she asked me to speak.
I was just reading the news out loud. But anyway, it's a very sad day, folks. You know what?
Absolutely.
Many cases don't come out. Few
Yeah.
come in the newspaper like this, isn't it? Otherwise, the people who die in the waiting room, they become the statistics. That's it.
Exactly. Exactly.
But anyway, Vinayji, thank you very much for your time. Appreciate it highly. And
Absolutely.
again, looking forward to see you in the next video. Okay.
Absolutely.
Hare Krishna.
Hare
Hare
Krishna.
Krishna.